When Carrie Perry takes Roxy out to play, she gets a rub down with tick repellent. There's no way Carrie wants to risk a tick inside her home. That's because Perry's daughter Samantha had a 3-year-long battle with Lyme disease starting in December of her sophomore year.
3-day higher fever, neck ache, headache, but then it resolved.
But a few weeks later, Sam began feeling exhausted. The competitive athlete kept going despite joint pain and nausea. In about 70% of the cases, patients develop a bullseye-shaped rash. Sam had no rash, so Lyme was overlooked for 7 months. UCF microbiologist Molly Jewett says there's a window of time after a tick bite when infection is difficult to detect.
As the infection persists longer and longer over time, those bacteria can move from that tick bite site to different places in the body.
Jewett and her team are researching how the bacteria evades the immune system. They're developing a new diagnostic test of a patient's blood for the very early presence of the bacteria. After Sam's diagnosis, she took antibiotics, but it was 8 weeks of hyperbaric oxygen therapy that finally did the trick. She's now a college junior studying abroad in Spain, recovered after years of agony.
People don't understand Lyme. They don't understand what one tick can do to a person.
I'm Marty Salt reporting.
Ready? Mommy's gonna try.
3-year-olds Adele and Aubrey may be twins, but they couldn't be more different from each other.
What color do you want, Deli?
A big difference between the two. Aubrey has 2 kidneys, while Adele, also known as Deli, has 1. When Deli was born, she was diagnosed with multicystic kidney disease.
She immediately went into renal failure.
Deli is doing well now with her kidney function at 78%, but
At this point, it's looking like she'll probably need a kidney transplant within the next 10 years or so.
when she does need her transplant, she'll be transferred to the living kidney donor list, all thanks to her grandmother donating her kidney to a complete stranger. Through the National Kidney Registry's donor voucher program, a donor can donate a kidney now and get a voucher for an intended recipient for a later living donor transplant.
Those timeframes are significantly shorter than you would have to wait for a deceased donor kidney. Deceased donor kidneys, you can wait anywhere from a couple of years all the way up to 8 and 10 years.
Just one living donor taking part in this voucher program can help more than 100 people on the transplant list.
I can inspire just 3 people to donate a kidney, and those 3 people can inspire 3 more people, and those 3 people can inspire 3 more people. If we did that just 11 times over, we could wipe out the whole kidney list.
Jamie's kidney donation started off a chain that impacted 8 people with 4 kidney transplants. But now she also has that safety net for her granddaughter for whenever she'll need her kidney.
Well, whose kidney is it? Deli's kidney!
I'm Marty Salt reporting.
Yeah.
74-year-old Bill Purcell's tremors started 5 years ago. It got so bad that he couldn't even enjoy his coffee without spills.
My wife didn't want me to carry a cup of coffee from the coffee pot to the table anymore.
Medication wasn't working, and he wasn't a candidate for deep brain stimulation. So Bill became one of the first patients to undergo a new non-invasive treatment at the Cleveland Clinic.
The focused ultrasound allows the physicians to target a very specific area of the brain, and as you slowly increase the energy over time, you can see the warming or the heating of the tissue within the brain itself.
The MRI-guided ultrasound creates a lesion on the part of the brain that causes tremors, and patients can be tested for progress after each session. Bill had immediate improvement after treatment.
We were able to give him a cup of coffee, which for the first time in several years he was able to drink without spilling any.
It's not Starbucks, but it's good.
Bill has regained the ability to write, and his hand no longer shakes. But more importantly, he has accomplished his goal.
My goal was to get out of bed and drink coffee without spilling. I did that, so my day was a success.
I'm Marty Salt reporting. 67-year-old Jim Gibbs was working full-time and feeling healthy until Super Bowl Sunday 2016. when he had a sudden pain in his left side.
The next day I was attending some meetings and it was there. It was nagging.
There were no signs, no other signs.
A CT scan showed something unusual on his appendix. His doctor ordered more tests.
He called me a week later and he said, well, it's cancerous and it's signet ring cell cancer.
Surgical oncologist Vadim Gushin says signet ring cell carcinomas are aggressive. Patients have very few symptoms, so the cells often spread before they're caught.
By the time a typical diagnosis of signet ring cell carcinoma of the stomach is made, the entire stomach is engulfed in the tumor.
Surgery may be a treatment option, but doctors can't always remove all the cancer. For Jim, Dr. Gushin added HIPEC, heated intraoperative peritoneal chemotherapy.
They hook you up to a pumping system that pumps in heated chemotherapy and it bathes the entire abdominal cavity and then they pump it out.
Most cancers recur within 2 years after surgery, so Jim spent that time volunteering doing cancer charity walks.
I can look back and say, you know, I spent that time in the most life-giving way that I could.
I'm Marty Salt reporting. Jack Stone had a pinched nerve in his leg for 4 years, but didn't let it stop him from living an active lifestyle until one day.
The scariest thing was when my right leg would go completely numb. That just, was very unsettling.
He knew it was time to get help.
I came to the conclusion I didn't want to live the next however many years I've got, 20 or 25 or 30 years, in that physical condition.
Jack became one of the first patients in Chicago to undergo spine surgery with new robotic technology. Standard spine surgery requires more time and radiation.
Each time I'm taking an x-ray to make sure I like where the position is of the probe, and then we take an x-ray before we put the screw in, then we take another x-ray to make sure the screw is in the right location. And that's a lot of extra radiation, not only to the surgeon but to the patient.
Instead, the Mazor X system creates a blueprint of the patient's spine, and a robotic arm guides the surgeon as they place screws into the spine. This allows for less radiation, saved time, lower costs, increased safety, and more efficient placement of screws.
To me, it's a home run.
Jack's surgery was a success.
I'm really pleased with the outcome. That's the biggest thing. The numbness has gone away. What pain I had has completely gone away.
And he's ready to get back to his active lifestyle. I'm Marty Salt reporting. And it may not seem like much, but to Mickey Nunn, being able to play bass guitar for his wife Teresa is a big miracle. More than 10 years ago, he was diagnosed with stage 4 prostate cancer. The cancer was inoperable, and Mickey had already undergone 42 treatments of radiation. So now he had 17 rounds of chemotherapy.
Chemo, for me, was just like throwing it on the wall and see if it stuck.
Even with all the treatments, his PSA score, or prostate-specific antigen, skyrocketed. A score above 4 is a risk factor for prostate cancer. Mickey's was 99.
The only thing that was left was pray to God for something, for a miracle. And he gave me one.
In Dr. Eddie Yang at UAB, Dr. Yang believes he can treat Mickey's tumor using precision medicine.
So precision oncology for us means to gather as much data about a patient as well as their cancer and trying to figure out what's the best treatment for them.
Researchers use a biopsy or blood sample from the patient. Then,
if we find that a patient's tumor has that particular mutation for which there's a drug against that mutation, then we put them on a study using that drug.
In Mickey's case, it was an ovarian cancer drug that seemed to work against his prostate cancer mutation. With this new drug, Mickey has been in remission for more than a year.
It's not just trial and error, but this here is made especially for me.
I'm Marty Salt